Hello, good morning everybody. Good morning and welcome. My name is Richard Norris. I'm the Director of the Scottish Health Council. Thank you very much for coming along today, and very pleased to see you all here, and we're very pleased to see so many people here, and also such a great sort of range and mix of people, which is exactly what we wanted. I'm not going to say very much at all because I'm going to hand over very quickly to Peter, but just to say we're aware, as I'm sure you're aware, that we're going through a very important change in how we deliver health and social care services in Scotland. And the process that you're taking part in here, we hope is going to be really important and influential in determining how those structures involve patients and the public as they go forward. So your input today is very much appreciated and is very, very important. I'm now going to hand over to Peter Johnston. Now, Peter is the Health and Wellbeing Spokesperson for COSLA. He's also, as well as being on a local authority, a member of the Scottish Health Council Committee. So Peter embodies integration in terms of the health and social care approach. So welcome Peter now to come up to the rostrum.
Thank you, Richard. In the interest of absolute transparency, I should also declare that I'm a non-executive member of NHS Lothian. And there you know all about me. 2013, I think, could be described in many ways as almost being a perfect storm. There are so many things coming in the direction of local authorities and the NHS. We have changes potentially in public involvement, community engagement, and of course the strangely worded bill, which I refuse to call the Public Bodies (brackets Joint Working close brackets open brackets Scotland close brackets) bill. It's the Health and Care Integration Bill, isn't it? But what a fantastic opportunity health and care integration is going to bring to us, to join together our health services and our social care services for the better delivery of clear pathways for the people that matter, our residents and our patients. I come from West Lothian, where we've had a very active health and care integration process now working for the last 8 years or so. So I've seen it working, I can see the benefits it can deliver and the opportunities that are still there. But fundamental to this, and why we're all here this morning, is this opportunity to change how we engage with the public. There are many things that both the NHS and local authorities do well currently, but there are many things we're not good at. For far too often, consultation is still seen as a meeting where public bodies appear and tell people what's going to be done to them. That is not acceptable. And certainly there's been hopefully a drift against that process for the last 15 years or so, but we've got a long way to go still. I think the research that's been done that we'll be discussing today is very timely and also very helpful. It flags up some points of good practice. So there are good practice that we can learn from both the NHS and from the local authority side. And we have an opportunity, just as we have an opportunity to shape health and care for the future, we have a genuine opportunity within the terms of the bill, which is quite explicit. There will be a requirement on health and care partnerships to engage. There's also going to be a requirement that that engagement will take place on a locality basis. So this question of telling people what's going to be done to them is dead in the water. It has to be. And instead of that, there's a recognition that we have to empower people. That people have to be given the opportunity to shape the services that are going to be delivered in their locality. So that's a fantastic opportunity. And today's one of 4 events that the Scottish Health Council are organising across Scotland, and congratulations to the Health Council for doing that. It's very timely, and it gives us the opportunity to be in at the ground level as we're promoting this change and looking to ensure that genuine public involvement is bottom up and that people are empowered to have the ability to shape the future. So I look forward to our discussions this morning, and I'm now going to pass on to our first contributor, who's Chris McNamee. Chris is a member of the National Advisory Committee for Heart Disease and is formerly a member of the Managed Clinical Network in NHS Lothian.